Hello, YouTube fans, and welcome to today's episode of Newsflash Thursday. I'm your host, Miss Patty from 4-Year CNA. And today I want to talk about an article that was posted on Valentine's Day on CNN. And it's a very concerning situation that I want to talk to you guys about today. Apparently, there are 7 nurses in Ohio who have been indicted by a grand jury on 34 counts of falsification of medical records, signature forgery, neglect, and even involuntary homicide. So these nurses have not been in court yet. They've not been found guilty of anything, but they have been indicted by the grand jury, which means that there's sufficient evidence to proceed to trial. And this is very, very concerning to me, especially because the headline is very attention-getting. The headline said that one patient rotted to death. Now, that's just horrifying, absolutely horrifying. And I don't want to talk about the crimes themselves. Mainstream media is doing a great job of that. They're covering the crimes in detail, and I don't want to get into that. What I want to talk about today is the culture in nursing homes that might actually allow this type of activity to happen. Now, my grandmother told me a long, long time ago that there's nothing more contagious than a bad attitude. And I didn't understand what that meant until I started working in healthcare. And I can tell you, she was absolutely right. Bad attitudes are absolutely contagious in workplaces, especially healthcare. Now, when we remember that we got into healthcare specifically to help patients, that's the care part of caregiving. And that's what brought most of us into healthcare to begin with. So how can we go from having this caring heart to completely neglecting patients to the point that they are rotting in a bed to death? I mean, that's just, it's beyond comprehension to me that could even happen. But I think that it's a much bigger problem than just these 7 nurses. I think that the apathy that rears its ugly head in a lot of healthcare settings becomes very contagious, and it spreads from one caregiver to the next. And before you know it, you've got an entire shift of people that just have completely forgotten why they're there. And they look at patients like they're an inconvenience, that call light is going off again, or I've got to feed this patient, or this one is just going so slow. We forget that these patients are there because they can't care for themselves at home. They need help. And this pervasive attitude that I see in a lot of healthcare institutions can really deteriorate the overall culture of an institution. So I want to talk about that. You know, that these 7 nurses certainly did not act alone. And the sad thing is the nurses are legally liable for what happened to those patients. The CNAs, they may have neglect charges brought against them, but for the most part, they're working under the direction of the nurses. So if the CNAs have a bad attitude and the nurse does not nip that in the bud and train the staff and reignite that culture of caring, this can get out of hand very, very quickly. And the nurse is legally liable for the actions that are happening to those patients under her care. So we need to understand that we have a role to play in this as CNAs. And we have to check our own reaction to the patients and our own facility culture to make sure that this kind of activity can't happen to us. And I think that every facility is at risk here. I think that every shift is at risk. And I think every team is at risk, because one bad apple certainly can spoil the entire bunch. Because if one CNA on the shift doesn't care and doesn't do their job properly and neglects the patient, and other CNAs that work hard but don't get a lot of acknowledgement see that, and they see this CNA getting away with not performing good care in caregiving, then those good CNAs, the ones that are performing care in a compassionate manner, tend to give up. Why should I go the extra mile? Why should I care? Why should I report things when that other CNA doesn't do all that and they get to keep their job? And I think that this degradation, this downward spiral can happen pretty much anywhere. So that's really what this article is saying to me, is that we really need to watch our own culture in the facilities that we work in. So what is your culture like? Are you performing the best possible care that you can, even if the others in your facility are not? And what kind of things can we do that would contribute to the culture of our facility, either good or bad? How can we affect the care that our patients are receiving? Are we checking our own attitudes to care? And if we're not performing care the way it should be performed, and you know how that is, you know the difference between good care and not so good care. So if we're not performing the care that we should be giving, what can we do about it? Is there some sort of education that would help, or some sort of incentive by your facility, or what would entice you to contribute to a positive culture in your facility? I'd really like to know. If you can leave me a comment below, let me know what your culture is like in your facility, and let me know what your thoughts are around developing a more positive culture where these types of things don't happen. And it really is concerning to me that there were many caregivers involved here, CNAs, nurses, and I'm sure even doctors that turned a blind eye to this patient and their ongoing issues, that things weren't reported. Or maybe it was a situation where the facility just did not have the resources. I know a lot of us work very short-staffed, and that's horrible. It is horrible when corporations put profit over patients. And we can only do what we can do with what we have. So this is your opportunity to kind of speak up and say, what would make your culture and your facility better? And I'd love to hear your comments. Please make sure that you like our channel, subscribe, and hit the bell for notifications so that you're aware of when the new videos come out. We have a weekly series: Motivation Monday, Test Tip Tuesday, Workplace Wednesday, Newsflash Thursday, Fashion Friday, and Career Spotlight Saturday, and we'd love to see you tune in for each one of those. If you hit the bell for notifications, YouTube will notify you when we have a new video up. Above all, please remember that what you do matters. You're the heart of caregiving. Until next time, happy caregiving.